Right, so please may I welcome everyone to the ABPN webinar for this afternoon. Our guest speaker is Ellie Forbes, and she will introduce herself shortly. We're really pleased that you've been able to join us. I would like to point out that we have got our president of ABPN, Professor Bernie Carter, on the call, and also Fiona Smith, who's the fellow of ABPN. I'm Jean Davis. I am the chair of ABPN, very privileged to be so. So I'd like to hand over now to our guest speaker, Ellie Forbes. Thank you.
Oh, thank you very much, and a warm good afternoon to you all, even though the weather might have us think otherwise. Delighted to be speaking to you about this topic. As Jean, you've kindly pointed out, I'm Ellie Forbes. I'm the programme lead for children's nursing at the University of Lincoln, and I'm also the honorary secretary delegate for the ABPN. So it's wonderful to see you all here. What I hope to achieve by doing this webinar is to really just shine a light on Lincolnshire and our development of this paediatric urgent care module. And I'd like to just start off by giving a huge thank you to colleagues of mine, some whom I can see are here today. Ashley Harper was instrumental in helping to get the module off the ground and to make it what it currently is. And so I'll start by really just explaining kind of where we are, what led us to put this module together, why and how it came about, and then where we are now, kind of 8 years on. My background I'll also explain, which kind of feeds into how the module is delivered and organised and run. So Lincolnshire is a big county. It is the 4th largest county in the UK. Hopefully you can see the slides. And what I've just put there is really the challenges that we have within Lincolnshire, being a big county, remote and rural, and where our health centres are within the county. So we have 2 main hospitals within Lincolnshire, Lincoln County and Boston, which I've highlighted there on the map. But you can see just the distance that children, young people, families have to travel in order to gain treatment and specialist centre advice and guidance from a paediatric perspective. Our nearest tertiary centres are Nottingham and Sheffield. So that spans quite a distance in terms of travel for specialist centre treatment. So what is the background to this module that I'll talk about in a moment? Well, I arrived in Lincolnshire in 2017, and at that time we had CQC ratings that were not congruent with standards relating to safety and leadership around paediatric delivery. My clinical background is in paediatric intensive care. That was for 10 years in both London and Australia. and then in clinical education for the last 18 years now. In that time, I was very privileged to be able to deliver a national programme around paediatric emergency care in Scotland. And that's really where the first kind of semblances of this module delivery came about, recognizing and understanding that babies, children, young people are seen by a range of practitioners in a range of care settings, both acute and community, and are seen by frontline practitioners from GPs, practice nurses, um, ambulance, paramedics, right through to paediatricians. And the commonality, the sort of thread that runs right through is people, is staff, is colleagues feeling underconfident in dealing with babies, children, and young people. And some of that is around not having enough exposure. Some of that might be around their feelings of not being competent or sufficiently trained, but yet that is a requirement of their post or their job role at the time. And also, I think it's worth saying that perhaps they just want to make sure that they are adhering to the local and national guidance. All too often, we hear in the news very tragic situations, and that can really heighten practitioners' anxiety, can't it? In around, are they doing the right thing at the right time for babies, children, young people, and their families? So in 2018, a request was made through our local partner trusts, myself and some senior colleagues, to really try and offer at this particular time a one-day training program. Could that be something that could help staff to feel more competent and to refresh staff with certain knowledge and skills around delivery and care of babies, children, young people? So we actually then moved into piloting a one-day study day. And it was very clear from both staff, from ourselves, and management that actually what was needed was something more than just one day study day. You'll know from your experiences, and certainly I was fully aware that one day was just not enough to cover, everything that we've spent years trying to understand and know and keep learning about. But there was something that we could do around improving confidence and in terms of working closely with partners in practice. And that would then also hopefully have that knock-on effect around recruitment and retention of paediatric staff. In and around this time, Lincolnshire were successful in gaining validation for an undergraduate and a master's level pre-registration programme of children's nursing. And that commenced in 2019. So this was all happening at a similar time. Very clearly, wanted to make sure that whatever we were delivering was aligned to national standards, and that really is the backbone, isn't it, of what we try and deliver from a curriculum point of view, but also for knowledge from a clinical practical perspective. So the module was starting to take shape in terms of aligning with RCPCH guidance, with, at the time, RCN standards, which were being published on competencies for staff working in emergency areas, being very mindful of as well around CQC and the RCPCH recommendations for emergency departments staffing. What came about, however, was the Big Six document, first published in 2014 from Gloucestershire Clinical Commissioning Group, and then updated in 2020 by Shropshire and Telford. These are the big six most common conditions that children present with in urgent care, and you can see those highlighted there. So that really, again, formed the backbone of the delivery. So yes, there are fundamentals that, again, I can explain, but it's really around those common presentations that would occur in both acute and community care. I mentioned as well around the standards and of professional development, which are again aligned with those practitioners working from an acute perspective, but also from a community and primary care perspective. So this module had to meet kind of all practitioners at varying different levels, whilst also prioritising those key baby, children, young people issues. What we also wanted to include was some elements of global health, not just public health, but global health, recognising transient populations, recognising some diversity that we experience within Lincolnshire, but I'm sure that you colleagues also experience in your areas and regions. There also had to be a big focus on patient safety, and it's on the previous slide. I'll show it again, but the Healthcare Safety Investigation Branch, or HSSB as it is now known, also has very helpful guidance and investigation into particular challenges around managing acutely ill children. And so that also formed a thread that ran through the concept delivery of the module. So as you might imagine, the key areas of delivery are around child development, around cardiac, respiratory, around abdo pain, around acute illness, acute injury, also very important. Global health, as I've mentioned, legal, ethical, professional issues, safeguarding. We also cover child and adolescent mental health. We also cover at various times, we have changed some of the sessions depending on what the group are asking. And that is really an excellent adaptive way that we can deliver. So one group specifically wanted content around chest X-ray interpretation, and we were able to include that in. Another group wanted more of a community and complex care focus, so we also were able to incorporate that. Now, with it being a level 7 master's level module, I'll explain why we run it at level 7. I think initially when we first set up the module, we perhaps tried to do all things for all people. And when it was initially created, we did run it at level 6. But it became very apparent that most staff working and looking after children have, a vast range of experience. But even if they don't, they're probably working at level 7. So why wouldn't they be supported to undertake a module at level 7? I can perhaps hear colleagues in the room who are very experienced academics who might have some question around that, and I'm quite happy to take those at the end. But our module was designed also to have 2 assessments, one being an OSCE, which is where they undertake a structured assessment. And you can see our assessment marking sheet. It's an old one, but it gives you a sense of what we're looking for. And practitioners undertaking the module must pass both elements of the assessment to achieve recognition and the academic award for the module. Now, I have had some practitioners who've undertaken the module but haven't gone through the assessment. And there are some challenges around that. But on the whole, most people will undertake both assessments. So a question for you that's often posed is, according to WHO, what is the most common chronic issue facing children today? Take a moment and just pop it in the chat for me. Or just have a think. So far, as I've said, we've delivered the module in its entirety since 2018. It's run once per academic year. And initially, there was some thought about running it twice a year, and it certainly can be flexible and adaptive enough to be able to do that. But we also have to be cognizant of staff being able to be released from practice, which I'm sure you can appreciate can be one of our biggest challenges.
Ellie, may we just intervene for a second? The chat now, things are coming in. So Elizabeth says about mental health issues, Amine about cardio, Lisa, access to specialist paediatric care, Becky, dental issues, and Amelia, obesity, Hannah, poverty. So you can see lots of things coming in there. Thank you.
Oh, that's excellent. And thank you all very much indeed for your contribution and for your sharing. I'll tell you the answer right at the end. Thank you.
Oh,
Thank you very much. So, we've had around 80 practitioners through, give or take. Some years we've had many more than others, so it's not reflective um, of the time of year. We do run it from the beginning of September, and it's delivered over 8 weeks. And that again was done based on our partners in practice who felt that that time of year, whilst it can be challenging, it does help those practitioners to have received their reward and their academic award in time for winter pressures, which is often when people are feeling most anxious about being able to look after babies, children, and young people. We have also been able to develop and gain um, uh, support from practitioners who've undertaken the module, who are now successfully working in a range of different areas that they hadn't been cited to prior to undertaking the module. It really has been able to create better links, both locally but also regionally. So as I mentioned at the beginning, the module is open to anyone in a practice setting who's working with children, young people, and their families. So in one cohort, we can have paramedics, we can have GP, advanced nurse practitioners, we can have um, practice nurses, we can have A&E staff, and we can also have paediatric registered staff who are wanting to refresh and update, or perhaps thinking about moving on for their own careers into more of an advanced practice route, and they want to do a standalone module to segue them into that route. So our cohorts can be really diverse, and what it's helped them to achieve is that shared learning. And certainly our colleagues who work in GP practice or in primary care have really valued and gone on to develop and foster um, and create professional collaborations with staff that they might not have ordinarily come across. So that's really lovely. So we do use two-way evaluation. We use that throughout the module, which has enabled us to be responsive and adaptive to the needs of the particular cohort. We use a range of different methods of delivery. We have our simulation suite that you can see a little corner of there. We also do online as well. And again, I have to say that during COVID, that was fantastic. We didn't have a single person drop out because we were able to flip our delivery online. And for some cohorts, we've maintained it online. And again, that's been really valuable because the module has been accessed by people outside of Lincolnshire, um, across the Midlands, who perhaps might have thought twice about accessing the module if they'd had to come to campus each day. So I'm drawing to a close and would really welcome any thoughts and comments any feedback, any questions. But of course, you'll all be wanting to know what the answer is to this question, which is in fact tooth decay. When I first posed this question was in 2019, and it has not changed. So tooth decay. Now, I'm sure there'll be people who will be trying to unpick the question in terms of, is tooth decay actually a chronic issue? But in terms of how the WHO have framed it, yes, it is. And you're absolutely right. It is very sad. And I think in part what that highlights is coming back to this, my first slide, and that a vast proportion, 30% of the children in our area are of low income families. Now, this isn't about making a judgment, not at all, but it's helping our practitioners understand the needs of our babies, children, young people in our regional area. So thank you very much indeed, and I welcome any thoughts, comments, reflections at all.
Ellie, I put my hand up. I did want to ask you whether within that geographical area there was anything like the Healthy Smile program, where in schools children are given toothbrushes, teeth cleaning lessons and toothpaste and so on. So can you tell us a bit more about that? And if anybody else on the call is aware of these health promotion activities, would you please just tell us or put it in the chat? Thank you.
Yes, Jean, absolutely aware of health promotion initiatives. In fact, not Healthy Smile, but there was a relating to sleep deprivation, another big issue that I'm sure is faced in many regions, that we actually had a school teacher who was recognizing that a number of young people were arriving at primary school extremely sleep deprived, and she worked with a local company to deliver free mattresses. So yes, there's an awful lot of work that our public health colleagues, our education colleagues are doing as well to support babies, children, young people in the region.
Thank you. Does anyone else want to add to what Ellie is saying? Right, Daniel, fabulous. You're the go-to person on this call. So, Daniel, do you want to say anything before I go to Professor Bernie Carter? Do you want to add anything to what you've said?
So just to say that I work within the trust in Devon, and we have an oral health improvement department who go out to various child and adult centres giving preventive advice. But our department of dentists and dental professionals is understaffed, and we routinely take about a year to see new referrals for children with tooth decay needing teeth out. There are almost no practices in our area taking child or adult patients under the NHS.
Thank you for that, Daniel. Yes, Professor Carter, please come in.
Hello, I'm just Bernie, but there you go, Jean, that's fine. I know it was a big initiative at one time. I'm not entirely sure if it's still continuing in Alder Hey, but they had a really focused thing about making sure that every child that was admitted to hospital had a toothbrush and toothpaste. And it was part of the education, because I think every contact children's nurse has, if at all possible, should be one in which you can sort of teach some of those simple things, whether or not we've actually got the resources in terms of being able to take toothbrushes and toothpaste out to every child. I think the Smile for Life and the other big interventions are fabulous, but I think we need to be alert as nurses or any other practitioner coming in contact with the child to think about the devastation that tooth decay does for children. And it's then linked in with so many other things that Ellie was talking about. It's linked in with poverty and what other people were talking about, respiratory conditions. There's just such a complex mix of factors that mess with children's very early years. So yeah,
Thank
well
you
done,
very
Ellie.
much.
Brilliant.
Yes, thank you very much. Really salient points from Daniel and Bernie. Thank you. Ellie, do you want to make some comments on what's in the chat? Can you see it now?
Yes, I can. Thank you. And absolutely really helpful there. Daniel and Bernie, really appreciate that. And I think actually what our those people that have attended the programme have really valued having input, having opportunity to have discussion around these really important topics, because they may well be parents themselves and they may well be the first point of call or the first point of contact for a number of these babies, children and young people across our region. And so if they know where to signpost, what organisations, what's currently happening, they have found that so valuable, as well as that acute kind of safe structured approach, which in all honesty, they do really well, and they just want that opportunity to say, is this right? Is this okay? And from a patient safety perspective, that's great. That's fantastic. But what they also go away with are some really helpful resources within our region that are locally designed. We have practitioners that come in from child and adolescent mental health services, for example. So some of the challenges that may be faced in acute care, they have an opportunity to ask those questions of practitioners. And that is really valuable.
Would you like to invite Kerry, who is a dentist in Gloucestershire? Kerry, would you like to add to what you've put in the chat? And maybe then Fiona would come in after Kerry has spoken, if Kerry would like to speak to us. Thank you.
Yeah, hi. I'm a general dentist in Gloucestershire, and at first I thought maybe I shouldn't be on this call, but then I realised it did relate into dentistry. But we have a long waiting list, so I've got 5 or 6 children under 5 who are on the waiting list for XDA, and one of my patients ended up in hospital with sepsis while she was waiting, and it's really, really difficult. We're above average for our decay rates, so we have lower than average decay rates for the UK, but still it's a huge problem in Gloucestershire.
Thank you very much, Kerry. Fiona, you've put some information in the chat. Would you like to add to what you put there, please?
Yeah, I've put some information that the ABPN has gathered recently, because we're planning on doing something around this next month. In terms of the link with deprivation, if a high proportion of children and young people are eligible for free school meals, that is a high indication of the potential for tooth decay. So I don't know whether the dentists on the call are aware of the level of deprivation and eligibility for free school meals.
I'm sure that we can have an answer in the chat. May we just go to Leanne? Leanne, thank you for your very valuable contribution there. Do you want to add to that and discuss that with us, please?
Yeah, so I'm based in the Lake District, obviously in the northwest of England, and we've had in the last few months several like promotions and things within our paediatric wards based around tooth and tooth decay, because we get the other side of it. We're getting the children coming in for their general anaesthetics to have tooth extractions, and on average these children are having between kind of 6 and 11, 12 teeth taken out each time. So we're doing promotion with children just as inpatients to try and prevent it, and then also working with the community dentists and the local dental teams in trying to prevent it long term. So while they're in there getting the teeth extractions, we're ensuring that they've got suitable toothbrushes, toothpastes, little timers and games they can play while they're brushing their teeth to try and encourage those kind of skills. We have notice boards up that are explaining about healthy swaps for children in terms of their diet and their intake as well. But our biggest issue is we have such a long wait for these children to get their teeth out, as it's been explained, because we, again, are quite a large county and we have quite a lot of deprivation. But we also have a severe lack of dentists. In recent years, it's the rate of NHS dentists have almost halved. So a lot of these children don't even have a dentist and have never been to a dentist. And it's the same with adults. I myself moved back up to the area and it's taken me 3 years to get an NHS dentist. And that's only because I actually had gone to an emergency dentist within my hospital because we had a dental part with an abscess, and the dentist that seen me was like, oh, I work at this practice, I'll register you so I can do ongoing care for you. But that's the only way I got into a dentist. So it's not even just for the children, we have it with the adults and things as well. So as an entire trust, our trust has done it for both children and adults, because we're getting the same with a lot of older people where they're not accessing the dental care either or being able to get those services. And it's the two ends of the spectrum. It's the young children and the adults, like the older adults as well, that are having the same issue.
Thank you very much, Leanne. Ellie, do you want to summarise now those points that have really made us think, haven't they?
Yes, absolutely. And I think, you know, even just raising the question has opened up some really valuable discussion. And again, I come back to this was in part the reason for facilitating a module such as this, so that there is opportunity to share, to learn, to signpost, to highlight everything from what's currently happening to based on literature, to how to unlock different challenges or blocks within the area, or even just support and recognize that it is a challenge, but what can we do day to day? So I think the discussion here has been really valuable. Thank you.
Does anybody want to come back in and add more? Fiona, yes, please do.
Hi, yes. I was going to ask the attendees on the call if there are from the presentation today, or indeed the issues that have been raised in the chat, whether there are additional webinars and discussions that we should consider for future webinars.
While people are thinking and hopefully contributing in the chat there, Bernie, would you like to come back in, please? Thank you.
Yeah, I think with many of these big six issues, they are issues that we can potentially do something about. That's not necessarily the way that a lot of nurses think or other health professionals think that they can act. And when I say political, I'm not being party political. I'm thinking of I can't remember, and I didn't want to look while I was on the call, but I was reading an article today about an absolutely huge illegal waste dump that is right next to a primary school. And the Department of the Environment is refusing to do anything about it. It's not their actual job to do anything about it, although you might think so. But there are many things within the environment, such as high pollution, which will add to asthma. There are things like those waste dumps that are causing noxious smells and gases and God knows what else. There are things like poor housing and within communities that we can actually contact people within our own local communities who may have the power to do something like that. And I think sometimes we see ourselves as doing our job at work, but not actually seeing us as part of the community that is with the power to actually do something. Although I don't use my title very often, if I'm ever contacting my MP, I always sign myself off as a professor of children's nursing because it has some power there. Maybe not very much, because I don't think I've changed the world by using it. But I think if we sign ourselves off as children's nursing when we're highlighting health concerns to, I don't know, local MPs, local town councils and things like that, we can make a change. It's an effort, but it's worthwhile doing. And there's really good work where people show that kind of like healthcare professionals lobbying can actually be the thing that actually flips things to change. Because we should be preventing the kids coming in needing urgent care.
Absolutely.
Ideally.
And thank you for that. I think even boards of governors in schools, you know, just any pressure group, that type of thing. So yes, thank you very much. Can I go over to Ellie now, please, for further comments or further summaries?
Yeah, again, I think, you know, it's something that was really noted within the development of this module, which, like I say, was across a range of different professionals coming together, really trying to service the needs for the babies, children, young people in our region, helped to have some of these really valuable conversations about what are the needs, what can we do differently, how can we support our colleagues who may be feeling underconfident but need support, help, guidance to unlock some of the challenges. And that has been a really powerful and perhaps unintended output from developing the module. So I'm really happy to share any resources, to share any of the pitfalls or the challenges, but also the benefits of this module with anybody. So please feel free to get in touch. I'm more than happy. I might also add, if it's something that you feel that your practitioners might be interested in, I'm very happy to look at how we can support that if you don't have something such as this within your local area. very happy to look at that.
Well, thank you for that offer, Ellie. I'm just looking to see if there are any more contributions that we want to pick up. I can't see any other hands up. Please just come back in. We have got some time left on the call if there's anything else you wish to add. Thank you.
I'm asking all the questions. I'm really sorry. Ellie, what is the hardest thing to teach people that are concerned? Because you said one of the things, and that people are worried, and fair enough. What is the hardest thing to perhaps that you have to teach, or the way that you teach to sort of make people leave feeling confident after 8 weeks?
Yeah, I think that's a really good question, because it's probably not until the end for some people that they can really work out if they do feel that they've improved. And then there's also the dreaded kind of, well, I won't know if I've improved until I've got my assignments back. But on the whole, actually, what we do is a fortnightly check-in. So because they attend 1 day a week, they're doing it alongside their day job. So there's almost an opportunity to immediately put things into practice. I think the biggest thing that people leave with is a lot more understanding of how babies and children, particularly the under fives, are likely to present. And that their compensatory mechanisms are different. What the module helps them is it gives them that safe space to ask those questions that perhaps they don't have time to do in practice and in reality. You know, they're busy, they're doing things very competently in practice, but they don't necessarily have all of the time to be able to say, well, why is that? Or why would a child compensate in such a way? So I think the biggest take home is that they're able to appreciate just how different physiologically and anatomically babies and children, particularly our under 5 age group, are. And at the other end of the spectrum, they're able to understand young people and adults and complex care issues.
Thank you. Lots for us to think about. And, you know, Leanne was mentioning the situation up in the Lake District, covering, certainly she made many very important points about the whole age range of the population. You know, if we've got healthy children, we're probably then much more likely to have healthy adults. So everything we do is really important. So at whatever age of people we're looking at. So right, Ellie, do you want to speak to Rebecca, who's put something in the chat there?
Yeah, of course. So it's really good to hear, Rebecca, that you're in your first year. We'd love to hear from you what your experiences are, and how you're progressing. So I'm pleased that you found that it was helpful to listen to this, and we wish you, of course, every success throughout your programme.
Thank you very much. If there are not any more contributions to make. If everyone has said everything they need to say, you know, we can close the call, but I'm going to hand over to Ellie because it is your session, Ellie. Thank you.
Well, no, thank you very much for the opportunity, Jean and colleagues from ABPN. I think what this does is shine a light, isn't it, on a whole host and variety of challenges that we face, but also the importance of these collaborative opportunities. And that's really vital to be able to help and support babies, children, and young people. So, look, everyone is busy folk. So, shall we give people 8 minutes of time?
We will, and we are particularly interested from colleagues of other professions, you know, are very expert people in dentistry who've been on the call, because we don't often get the opportunity to bring those views in from elsewhere other than our own community of practice. So we're particularly grateful for those inputs, aren't we? Well, thank you very much, everyone. And I'll just go over to Fiona, who will say when the recording will be available and what might be coming up. So, last word to you, Fiona. Thank you.
Okay, the recording, the slides will go onto the ABPN website as soon as Ellie manages to get them to me. And likewise, the recording I will add to the website as soon as Jean manages to send it to me. In terms of the next session, there is another webinar on Tuesday next week. And it's Sarah Clayton talking about postural care for children with complex healthcare needs. So we look forward to many of you joining us then.
Thank you, Fiona. Thank you, Ellie, and all the contributors, and thank you for joining us today. Good luck. Bye-bye.
Bye.